Good morning, everyone. So I'll be presenting my free paper on the topic Pigmented BCC, the uninvited guest at 30. It's not working. So BCC is indeed the predominant form of skin cancer, predominantly afflicting sun-exposed regions of fair-skinned individuals, aged over 50. It constitutes a substantial proportion of malignant eyelid tumors, accounting for approximately 90% of cases. It's not moving. टाइमर शुरू से लगा दीजिए. BCC is indeed the predominant form of skin cancer. It constitutes a substantial proportion of malignant eyelid tumors. Still not working. However, the occurrence of BCC, particularly younger individuals, remains relatively uncommon. This case highlights the rarity of BCC in a 32-year-old female, underscoring the importance of recognizing atypical presentations of this malignancy. Our patient was a 32-year-old female presented with painless black lesion located just above the medial canthus of her left eye, progressively increased in size since 8 months. The patient denied any visual disturbances. So this was the patient. The lesion measured approximately 5 mm in its largest diameter and exhibited no color variegation or discharge. Upon examination, it displayed well-defined margins and a lobulated surface. On the basis of history and examination, the differentials of melanoma, pigmented BCC, melanocytic nevus, and melanoacanthoma were made. The patient underwent counseling regarding the surgical excision, which is gold standard. The objective of this procedure is to achieve complete removal of the affected tissue with clear margins. Following the excision, the histopathological examination was done, and these are the pictures of the patient post-operative day 2nd, 7th, and 14th. Histopathological examination showed a tumor of long, thin, branching anastomosing strands of BCC with some strands showing connection with the surface. There were nest of cells with peripheral palisading and retraction artifact. The cells have well-defined borders with oval to elongated spindle-shaped nuclei with minimal pleomorphic fine nuclear chromatic and inconspicuous nuclei. Cytoplasms show heavy pigmentation at bases. So these are the pictures of the histopathological slides. First showing the gross specimen of the nodular growth, second showing the peripheral palisading, and third the retraction artifact and scattered melanin pigments. After his histopathological examination, the patient was scheduled for re-surgery to achieve tumor-free margin. Sorry for the bad picture. Unfortunately, the pictures were misplaced. Further excision was done and filling of the defect with Limburg flag was done. Limburg flag was created and advanced over the defect, and histopathological of the excised tissue was done, and it did not show any evidence of BCC. Now the patient is under follow-up. This is a picture of the patient post 7 months of Limburg flap reconstruction. BCC stands as the most prevalent type of skin cancer. It manifests in various forms, including nodular, pigmented, cystic, superficial, micronodal, morphiform, and infiltrating, nodular being the most common. While BCC infrequently metastasize, they possess a notable propensity for local destruction. Pigmented BCC is both a clinical and histological variant of BCC, distinguished by the presence of brown or black pigmentation. This subtype accounts only for 6% of all diagnosed cases. This case underscores the uncommon occurrence of pigmented BCC in a 32-year-old female. Pigmented BCC may resemble other lesions also, as described earlier. Clinical differentiation based solely on morphological can be challenging, necessitating histopathological examination for definitive diagnosis. In this case, the absence of symptoms and the patient's young age further complicated the diagnostic process. The preferred treatment usually for pigmented BCC is surgical excision. MMS technique is usually done for larger BCCs. Following treatment, the recurrence of BCC same site is possible. Notable characteristics of BCC is its tendency to recur in new locations in individuals previously affected. Approximately 50% of patients with a history of BCC have the potential to develop a new skin lesion within a 5-year period. So in conclusion, this case highlights the rare occurrence of a BCC, pigmented BCC in a young patient and emphasizes the importance of histopathological evaluation for accurate diagnosis. And surgical excision remains the primary treatment modality, with careful consideration given to cosmetic outcomes and preservation of function, especially in periocular regions, and regular follow-up is essential due to the potential for recurrence at the same time or development of new lesions in previously affected individuals. These are my references. Thank you.
What other ways could you have reconstructed that area? What are the other ways of doing surgeries in that area?
So we can use, sorry sir, I have no idea regarding this.
Take Limburger's plan.
Sorry ma'am?
In this case, Limburger's plan.
So that was done was a plastic surgeon in our case.
Which center you are from?
Ma'am, sir, GMC Jammu.